This is my EBP project about music therapy for postoperative orthopedic patients' pain relief. My introduction about this is that the EBP project will show how music therapy can help improve pain management for patients that have just undergone orthopedic surgery, which is one of the more painful types of surgery because it involves lots of muscle and the bone. Some background information is that orthopedic surgeries are the most painful type of surgery, and that 50 to 75% of the postoperative patients feel like they don't get enough pain relief from just the standard postoperative care. Also, that pain is stressful for both the patient and the nurse because the patient is in a lot of pain and keeps pressing the call light to call the nurse. Also, that pain impedes recovery progress because the patient won't feel like getting up and out of bed, and they'll be more likely to have postoperative complications. And my PICO question for this project was, for adult orthopedic patients, how does music therapy, compared to no music therapy, affect pain management within the first 48 hours after surgery? So the clinical practice problem about that, I investigated to see if implementing music therapy in postoperative patient care helps with the patient's pain or not. The search strategy that I used to gather evidence for my evidence-based project was that I used the ASU1 search. I had to change the filters until I got the list down to 10 to 15 results, and from there I was able to find 2 good quantitative research studies about music therapy and orthopedic surgery. One of the 2 studies that I found was from Schneider in 2018. It was a quasi-experimental study and used a convenience sample of 42 postoperative orthopedic patients in a hospital. They were each given a CD player with a preloaded CD of instrumental music with a slower tempo of 60 to 80 beats per minute, flowing repetitive rhythm without any percussion, and no lyrics. They were each given a log to fill out about their pain levels before and after listening to the music. In a comparison of the data from all the logs collected from the patients, the results showed that the pain was significantly reduced because the average pain scores went from 5.43 on the 0 to 10 pain scale before listening to the music to 3.97 out of 10 after listening. 100% of these patients said that they would recommend the music intervention to others. This was a level 3 evidence study, and it's relevant to my PICO question because it shows that there is a dramatic decrease in pain level for patients who get music therapy. The second study that I used for my EBP project was by Gallagher et al. In 2018, which was an experimental randomized control trial. They did it with 163 postoperative orthopedic patients in a hospital. They put 79 of them in the control group, and they got standard postoperative care, and 84 of them were in the experimental group, and they got daily music therapy sessions with a music therapist. Each group filled out forms about how their pain was doing each day, and then that information was compared using statistical tests. These tests showed that there were significantly better outcomes seen in the pain among the experimental group compared with the control group. Those in the control group saw, on average, a 0.25 point improvement in their pain score, while those in the experimental group had their pain improve on average by more than 1.25 points. This research study was a level 2 evidence, and it supports my PICO question because it shows a significant decrease in pain level for patients that participate in music therapy with a therapist on a daily basis. There are a lot of studies that support the fact that music therapy positively affects postoperative pain management. The proposed practice change is to implement music therapy into postoperative orthopedic patients' standard of care in the hospital orthopedics unit to improve their pain management. Improved pain relief could help prevent complications brought on by immobility, such as atelectasis, deep vein thrombosis, and paralytic ileus. The nurse manager is the one that I would contact about putting this change into the unit. I would ask her some things like how long she's been working with orthopedic patients, what her experience working with or postoperative orthopedic patients is, what the current best practice for managing pain is, and are they actually implementing that method or not. For the patients, I would approach them in person on the unit to ask how their pain management is with the current method with the standard postoperative care. I would ask what pain management options has your healthcare provider prescribed to help you keep it under control? How well have these options worked for your pain? And do you feel like you would rather an alternative to pain management instead of opioid pain medications or some kind of complementary pain management? In order to implement this change in practice to add music therapy to the orthopedic patient's standard postoperative care, it will require using some implementation strategies. To begin, we would need to help the nurses, nurse managers, and other clinicians have interest in the proposed change by highlighting the positive characteristics and the anticipated advantage of the change and the compatibility with their values. And this could be done via staff meetings or emails, or the nurse manager could round on the unit. Another strategy that could be used for the implementation is to celebrate the short-term wins. When consistent positive trends occur, both nursing units and individual staff can be recognized for their contributions to the success of the program. A third strategy for implementing change to practice is to see what methods need changing over time, such as the change to MP3 players instead of CD players, or changing to using music therapists instead of just listening to music. Another change could be to let the patients choose their own music selections from a list of approved music that was selected by a music therapist. Another thing to keep in mind would be to see if we didn't only start the music therapy after the surgery, but before it as well, to help reduce the anxiety of waiting for the surgery to begin. After we get everything ready to implement the practice change, we then need to communicate the change to the nurses that will be using the music therapy with their orthopedic postoperative patients. The nurse manager is the ideal person to communicate this change to the staff. The information will be shared in various ways, such as staff meetings, on the hospital employee website, through emails, or talking to the nurses on the floor. And this will help people get accustomed to the change because it's hard for nurses to change to new ways of doing things when they've done something for many years, even if it's going to improve their care of the patients. So it would be best to implement this before the practice change so they can start getting used to the idea. The information that will be shared with the nurses on the orthopedic unit is how the music therapy for pain management will be implemented, whether it is with music therapists or the nurses handing out CD players and instructions to the patients and collecting them when the patient is discharged. To evaluate the outcome of the implementation of music therapy to see how it affects the pain management of the postoperative orthopedic patients, We need to ask the patients themselves how their pain improved with music therapy versus just the pain medications and regular postoperative care. They could fill out a survey at discharge, or they could fill out logs about their pain before and after listening during their stay. The data would then be analyzed by the nurse manager or by someone who she delegates to see how well the change is improving the pain management of the patients and diminishing the previous frustration of nurses and patients that was due to poor pain management. The practice change will be successful if the patients have reduced pain because of its implementation into their standard of care. And finally, here are the references from the 2 research studies I found that support my PICU question for this EBP project.